we will shift to my friend, my brother, my colleague, Professor Ossama Mossallam. Professor Ossama, he's actually my schoolmate. We graduated from Qasr Al Aini Faculty of Medicine, same batch, 1977. He is really, honestly, he is the famous man of health management in Egypt. I will not say in the Arab area. He was an ex-associate professor in Harvard University. He's a consultant of health management in many hospitals. He arranged many hospitals training courses in management. He gave, I think, many of the managers taking care of health facilities in Egypt are his students and trainees. And in the last few months, he led a wonderful awareness campaign about applications of artificial intelligence in health. I may call my dear brother Osama. Please, Osama, start your wonderful talk about roadmap of introducing artificial intelligence in emergency triage in smart hospitals. Thank you. Please, Osama.
Thank you very much, Professor Muhammad, for the wonderful introduction. It is my pleasure to join you in this webinar or conference to talk about roadmap for introducing AI in ER triage in hospitals under siege. Excuse me, I was not aware that the language of the conference will be English. So I have a kind of mix between Arabic and English in slides and in my presentation. The ultimate goal is to find a kind of balanced view regarding the artificial intelligence without underestimating its impact and its functions, or overestimating its functions, so to reach a kind of balanced understanding of what is AI. In order to talk about the topic, we need to define intelligence, artificial, triage, and many other topics. Number one, intelligence. Intelligence, in a very simple definition, is reasoning. It is to find a relationship, to find a logic. Intelligence is not related to the scientific degrees. It is not related to what extent we achieved in science. It is independent of any knowledge from the past. This is according to the definition of Raymond Cattell. So it is a kind of finding a relationship pattern to analyze reasons of a problem, to suggest solutions for a problem. This is a normal distribution curve for the IQ, intelligence quotient, or of the population in general, the human population. Most of the people will be between 90 and 110. Below that, it's going to be a low IQ. Above that, it's going to be somebody smart, super smart, or 150, it's going to be a genius. This is a real test from the IQ test. It is a simple example to give the flavor what is intelligence. So have 5 figures here asking for what is the different figure among the 5. So we have triangles, we have squares, we have circles. We are going to discover by the IQ that we have, that the last one to the left is the figure, which is different because it is a circle inside a circle, while all other fours, they have two different diagrams. Here it is a very interesting Arabic and English. كلمة دلو بالنسبة لكلمة ولد، لو لرقم 179 هتبقى إيه؟ هنا التلاعب بين اللغة العربية وبين الأرقام أيضا. هنلاقي إن دلو ولد إحنا عكسنا آخر حرف وأول حرف، فبالتالي 79 هتبقى الإجابة بتاعتها 971. Endless examples. أنا حبيت to give you the flavor or the taste of the IQ test because we are talking about intelligence, artificial, triage. So we have to define these three main terms before going further. Here, what is الرقم الذي لا ينتمي لهذه المجموعة? We are going to observe this is primary numbers, cannot be divided by any other numbers except itself, except 9. It can be divided by 3 or 9. So this is the flavor of the IQ test. The IQ of Albert Einstein in many sources in 160, genius. We haven't talked yet about the artificial intelligence model, but one of the most popular model of AI is ChatGPT-4. In some sources, the IQ of ChatGPT-4 is 155, which is very close to the score of Einstein, and we are expecting to have ChatGPT 5 very in the very near future. So this is intelligence. What is artificial? So the human intelligence, this is a normal intelligence, while the machine intelligence is the artificial intelligence. Technically, we have just very broad classifications of artificial intelligence into narrow or weak, number 2, general or strong, and number 3, super. Actually, the name narrow or weak is misleading. It is a very powerful AI model. For example, the autonomous car without driver is a kind of weak or narrow artificial intelligence. General or strong intelligence, it is to have a machine that's thinking exactly like a human being. We haven't reached it yet, but the plans to reach it. Super intelligence is to have a machine with IQ smarter than the human being. And this is very terrifying. And I am going to explain why. Last month, actually, a very important company in USA appointed a robot AI model to become the CEO of the company. It is what's called a humanoid robot, which has facial expressions, voice, eye contacts, etc. Mika in her office in the first day to work as a CEO of the company, and the shareholders decided to select her because it is much smarter than human CEOs. So they are taking care of their investment and their money. So they are serious that she can manage the business much better than a human being. The true history of or the origin of the AI we have to be proud of. Maybe we know the name, but we don't know the photo. It is Al-Khwarizmi. Actually, I asked ChatGPT 4, which is AI model, in Arabic, who is الخوارزمي؟ من هو الخوارزمي؟ فقال لي الإجابة باللغة العربية: الخوارزمي هو أبو عبد الله محمد بن موسى الخوارزمي، وهو عالم مسلم برز في مجالات عدة كالرياضة والفلك والجغرافيا، وعاش تقريبا في القرن ال19، آسف، في القرن التاسع الميلادي، ومن أهم شخصيات في تاريخ العلوم، وإسهاماته الكبيرة في الرياضيات. وأشهر كتاب له كتاب المختصر في حساب الجبر والمقابلة. وكلمة الجبر كلمة عربية استخدمها الخوارزمي في الرياضيات ونقلها عنه العالم كله. وكلنا لما بندرس الماث in English بنقول الجبرا، which is الأوريجين بتاعها الجبر اللي وضعه الخوارزمي. تشات جي بي تي 4 the AI model كتب في الآخر إن هو عالم فلك أيضا، واسمه مرتبط بكلمة الخوارزميات اللي هي بالإنجليش algorithms. وأتحدى إن أي حد سبيكر بيتكلم في ال AI talk without using the word algorithms. لنا أن نفخر بأن العالم كله بيردد في الارتفيشال انتليجنس اسم الخوارزمي، وهو مصطلح الالجوريزم الديفينيشن بتاعه يستخدم في علوم الحاسب للدلالة على مجموعة من الخطوات المنظمة لحل مشكلة أو لأداء مهمة معينة.
Professor
أيضا
Osama,
I asked.
Professor
Yes.
Osama, please, can we stick with English language because most of the attendees are not Arabic.
Yes, actually, it was my mistake. I was not aware that it is in English, so I used some
No,
Arabic
I'm not talking about the slides.
slides.
I mean, I'm
Okay,
talking about
okay.
what you say. Thank you, sir.
Okay, so I asked also ChatGPT 4 regarding the definition, the who is al-Khwarizmi in English, and he used the word algorithms, and he said that he is a Persian polymath mathematician, and he defined the algorithm. And because in English or in Latin we don't have حرف الخاء الخوارزمي, so it was changed into algorithm. Actually, al-Khwarizmi, who put the Arabic numbers using a very smart way, that the number of angles in each number reflecting the value of the number. So this is number one angle, number two, etc. And unfortunately, the digits that, or the figures that we used in Egypt, at least, is Indian, not the Arabic ones. Then I have to talk about the definition of illiteracy. Long time ago, it was very clear that illiteracy is not knowing how to read or write. And maybe 40 years ago, the definition of illiteracy had been changed to the not knowing the computer terminology and the computer science, to be knowledgeable in that respect. In the last 2 years, maybe the definition of illiteracy has been shifted from computer science to not being knowledgeable in the area of artificial intelligence. So let us talk first regarding the bright side of the artificial intelligence. Actually, just a year ago or more, while having COVID-19 pandemic, two companies in the world, pharmaceutical companies, used a new technique for having the vaccines instead of the traditional one by injection of attenuated or killed virus, using what's called mRNA, which is pure artificial intelligence technique to develop the vaccine. So already we have it in healthcare in a very massive way. 49% of the American people vaccinated by Moderna, 51 by Pfizer, both of them developed by artificial intelligence using mRNA. This is the structure of the or the pyramid of the artificial intelligence, starting from the base by clouding, having the data in the cyberspace, then integration, Internet of Things, automation and robotics, and finally to reach the artificial intelligence. So we have digital transformation. This is the biggest figure in USA in the area of infectious diseases, and in COVID-19 had been vaccinated using artificial intelligence vaccine Moderna. Then we defined now intelligence, artificial, and what is triage? Triage is a kind of setting priorities. We use colored codes to determine who gets care first in case of emergency. We have the history of triage maybe back to the 18th century during Napoleon's wars. A French surgeon put the base of categorizing the cases received during the wars according to its severity and its need to be served first. Then in World War I, it has been very important because having a high number of casualties. So it has been improved a lot how to categorize the cases. By the way, this definition I got it from ChatGPT 4, an AI model. Now we are using in the artificial intelligence, use artificial intelligence in the ER, in the triage, in the ER. Very interesting figure. One of the best hospitals in the world, Johns Hopkins, they made a study that they discovered then an average of 20% of patients are misassessed by the healthcare staff in the triage. Where? In Johns Hopkins. Okay, so this is a very high figure. So they started using artificial intelligence in the triage in the ER. It's a kind of software that's going to help the medical staff, whether nurse or doctor, to decide the level of the severity of the case. We have more than one, maybe 4 or 5 categorization of the cases in the ER during the triage. They are very close actually, and they are using colors to indicate whether it is a resuscitation, urgent, very urgent, or less urgent, or non-urgent. This is the Canadian triage. We have also the UK triage, Manchester triage, very close, but putting timing for the maximum number of minutes that such patient must be seen and treated, going from immediate care to very urgent to standard to non-urgent, and different colors and different time frames. This is Australian triage, and actually some of the hospitals in Egypt using the Australian triage. It is also related to time, from resuscitation to emergency to urgent to semi-urgent to non-urgent. Actually, I have the honor to supervise 5 projects for introducing AI in the ER triage in 5 hospitals in Egypt. From even geographically, they are distributed from a medical complex in Ismailia to شرق المدينة in Alexandria, to مستشفى المقطم medical insurance, to مستشفى دار السلام mainly with oncology cases, and also Saudi German hospital representing the private sector in the study. Triage in crisis is different, or it has its restrictions. We have much higher number of casualties. I'm sorry, there is some technical problem. Okay, just from the, give me a feedback from the technical people in the conference. Do you see the slide that is the dark side of artificial intelligence?
تمام يا أسامة، تمام يا حبيبي، تمام.
Okay, thank you, thank you. So actually, we'd like to have a balanced understanding of the AI. It has a bright side, and also we have to unveil the dark side of artificial intelligence in general and in healthcare. This is why I use Arabic term, if you allow me, خدعونا بقولهم حسناء. This is a very nice phrase that I use in many presentations. Actually, it is by أمير الشعراء أحمد شوقي. خدعوها بقولهم حسناء والغواني يغرهن الثناء. It has its dark side. For example, 4 or 5 months ago, Italy became the first Western country to ban ChatGPT, which is a very powerful artificial intelligence model. Maybe they later on going to change this decision, but it was a very interesting point to stop and to think. While in Arab Emirates, 6 years ago, they appointed a minister in the cabinet for the artificial intelligence. So there is a kind of uncertainty regarding even states and countries how to deal with artificial intelligence. It is not very clear what should we do, from banning to have a top-level management person responsible for artificial intelligence. It's a very famous quote for the American President John Kennedy, that he said that when I don't like to have a decision, I just formulate a committee. This is what happened in many countries. Instead of taking very clear stand like Italy or the Emirates, here to formulate a committee to study what should we do with the artificial intelligence. Really, it is very important to have a balanced understanding of artificial intelligence. It's a very famous book maybe in 1999 by very famous doctors and surgeons in USA. The book was The Origin of the Science Quality in Healthcare. The title was To Err is Human. To err is human. And actually in Arabic we have الحديث الشريف كل ابن آدم خطاء. لو حد متمكن من اللغة الإنجليزية to translate كل ابن آدم أو كل بني آدم خطاء, to err is human. وخير الخطائين التوابون, to have a corrective action. So to err is human, but using artificial intelligence to err is not robotic. The chances of errors very close to zero. No fatigue, no need to sleep, to eat, working 24 hours, 7 days a week, the whole year. Okay, so there's a competitive edge using robots in ER, in triage, in surgery, in healthcare in general. Okay. The issue, the dark side, that the most famous and the most highest level in artificial intelligence in the world, and definitely in Google, stepped down 4 months ago. And he said that he was expecting to have a super intelligence model, which is much smarter than human beings after 30 to 50 years. With the recent trends in artificial intelligence, including ChatGPT-4, which we are expecting ChatGPT-5, and Google in the next few days is going to give a model which may be higher. It's called Gemini. He is expecting to have the super intelligence model smarter than a human being, maybe in 3 to 5 years. So he stepped down, and instead of taking the responsibility alone, he said that all the human beings, the 8 billion people living on Earth, are responsible to take care of what is going to happen if we are going to have AI smarter than human beings. And it's very close to what happened to Alfred Nobel when he's a chemist. He was a chemist and Swedish and working in the lab, and then he reached to develop the dynamite. So he felt guilty in spite that he didn't use it in the war, whether War I or World War II, but he felt that he is responsible for what happened. This is what make our friend really Jeffrey Hinton to be feeling responsible for reaching a super intelligence model. Okay, it's very important as a closing to decide and to know who owns the data, whether in hospitals or in healthcare or in general. Who owns the big data and who shares the data? Not even between developing countries, even between developed countries. Is China and USA sharing data, etc.? So this is a very dark side in artificial intelligence. Do we have, all of us, the same level of accessibility to artificial intelligence model? Does hospital under siege, they can have access to software for artificial intelligence in triage? This is the difference between equality and equity. This is very interesting. It looks funny, but it happened. Very famous humanoid robots went to Geneva in Switzerland, in the UN building, the United Nations, and they organized the first robot-human press conference. Super smart. Actually, this is the most famous nurse in the world. It is a robot, humanoid. It has facial expressions, expressing, agreeing, disagreeing, eye contacts, hand movements, etc. And the most advanced humanoid healthcare robot, her name is Grace. And they say that we are going to help human beings in their life. We are not enemies. We don't want to make any harm to mankind. And such press was few hours before a webinar in artificial intelligence that I organized 3 months ago. And we put a poll among the attendance. Actually, it was something like more than 500, and 83% of them said that we don't trust them. Home message. I'm not sure if the link with artificial intelligence is going to be very helpful or very harmful. But I would like to close by بيت شعر باللغة العربية. الشيخ زايد من هواياته الكبيرة في منطقة الخليج وشعوب الخليج استخدام الصقر في الصيد. وبيدربوه very well trained in having الفريسة. بعد ما يصيدوها أو هو يصيدها يجي بحالهم لغاية عندهم. هنا بيمسك الفريسة، هنا بيسلم الفريسة ايه بيت الشعر؟ بيت الشعر للشعر العربي العظيم أبو الطيب المتنبي بيقول: ومن يجعل الدرغام الأسد بازا صقر لصيده تصيده الدرغام فيما تصيده. قبل jumping into the artificial intelligence, we have to own our artificial intelligence, our level of artificial intelligence. باللغة العربية أي من يجعل الأسد أداة صيد صقر فقد أهلك نفسه، لأن الأسد سيصطاد ضمن فرائسه، وذلك إن الأسد لا يمكن ترويضه ولا يصطاد إلا لنفسه. So we have to have our resources in artificial intelligence in order to use it for the benefit of our people and for humanity. Thank you very, very much for your attention.
Thank you so much, dear brother, Professor Ossama, for this illustrative, informative lecture. And really, you have opened a very important gate for application, triage during emergencies and during disaster time. Thank you so much.